We want to make sure applying for your X-waiver is fast and easy, so let's go over how to complete your DEA X-waiver application. The 8 to 24-hour education requirement has been removed for both doctors and advanced providers who are prescribing to a maximum of 30 patients at one time. Now, providers can apply for an X-waiver without any mandatory education. However, that doesn't mean you're alone. CA Bridge has a host of trainings and resources for you to get started in this work. So, who can apply for an X-waiver? To prescribe buprenorphine to treat opioid use disorder, you must be licensed under state law to prescribe Schedule 3, 4, or 5 medications for pain, registered with Substance Abuse and Mental Health Services, or SAMHSA, and have received notice of an X-waiver. Though the X-waiver is still required to prescribe buprenorphine, it can be administered in the emergency department without an X-waiver for up to 3 days, or in the inpatient setting for the entire time the patient is in the hospital. Registering for your X-waiver is easy. To get started, make sure you have your state medical license and DEA number handy. If you're an advanced provider, you may also need the name, phone number, and DEA number of your supervising physician. The first step is to go to the buprenorphine waiver notification page on the SAMHSA website. You can scan this QR code to go straight to that site and follow along as you fill out your application. On that first screen, select yes or no based on your federal employment status. Then click Next. On the next page, enter your practitioner type, licensing state, state medical license number, and DEA registration number. Then click Submit. A pop-up window should open up that looks like this. Click OK on the pop-up window. Next, you will choose No and check I wish to apply for the 30 patient level with exemption, no training required. Then click Next. In case you're not sure if your practice setting is qualified, let's go over the qualifications. You can see the full list of which type of practice settings are qualified, but basically, all emergency departments and inpatient hospital units are considered qualified settings. For steps 1A, B, C, and D, enter your complete name, state health professional license number, license state, professional discipline, and DEA number. For steps 2, 3, 4, and 5, enter the address of your primary practice location, your phone number, work fax number, and email address. Confirm your email address. For step 2A, select whether or not the location is a federally qualified health center. For step 6, the box will auto-select the patient level based on the information earlier in the application. Check the box for step 7. For step 8, the box will be auto-selected. If you're an advanced practice provider, there will be additional criteria under Step 8 present in your application. Please read through this criteria and select the options that are relevant to your practice. Make sure to check, I certify that I am licensed to prescribe Schedule 3, 4, or 5 medications for the treatment of pain under state law. Of note, if you are in a state with practice agreements, such as California, and have a practice agreement established at your site, you do not need a qualifying supervising physician. For Step 9, check the box. For Step 9B, select, I certify that I will not exceed 30 patients for maintenance or detoxification treatment at one time. For Step 10A, choose whether or not you would like to release your name, primary practice address, and phone number to the SAMHSA Treatment Locator website. For Step 10B, select No, No, and No. Select the box for Step 11. Type your name to sign the electronic form and re-enter your DEA number to verify. Click Submit. You should be directed to a page verifying the success of your submission. If you get an error message regarding uploading documents, that is okay and will not affect your submission. It should now take about 45 days for SAMHSA to review. Once SAMHSA reviews and approves your application, they will email you an approval letter. The process can take about 2 months. You can also check your approval status at the SAMHSA website. Your X-waiver will be active and visible at this website several weeks before you receive notification in the mail. If you have any questions or concerns, please reach out to SAMHSA. Once approved, your X-waiver number will simply be your current DEA number, but with an X instead of your current first letter. You will need to include this number on all prescriptions you write for buprenorphine. Though the training requirement is no longer mandatory to obtain an X-waiver, it will still be helpful to review the resources listed here to get started treating opioid use disorder. For more information on buprenorphine prescribing and pharmacology, visit cabridge.org.